Here we are, Real Recovery Talk. I am your host, Tom Conrad. In today's episode, we've got Benjamin B.
What's happening, everyone?
And we also have Dr. T.
How's it going, everyone?
First things first, thank you for tuning in on the podcast app, whichever one that you choose to use. And thank you for watching on YouTube. In the end, if you have any comments, questions, or concerns, you could always email us, info@realrecoverytalk.com. What are you laughing at?
I just think this is great. I just noticed that you took away my flip screen over there.
And put it over
and
there.
You gave me my own.
At info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message. Right, Ben?
Yes, sir.
What? Do you not like being able to see yourself?
No, I do.
I want you to look in that lens right now and say, thank you for being here.
Thank you for being here.
Tambini, I want you to look in that lens right there and say, thank you for being here.
Thank you for being here.
Thank you for being here. Whew, it's hot in here.
It is hot.
It is, and I'm wearing long sleeves.
Yeah. Oh, I'm feeling verklempt. Anyways, we haven't been on here in a few days, so I'm glad we're reunited, and we are just going to get right into it because Ben, you're running low on time because you have to go train the clients, and maybe when you're done, we can record another one.
Yeah, I like that idea.
Yeah.
Sure.
Are you on a time crunch?
Oh,
No.
well, Dr. T has to see our clients.
Oh, that's right.
But we can make it work.
Okay.
Yeah.
All right. All right. What are we talking about, Ben?
What are we talking about, Dr. T?
Today we're going to talk about commonly not prescribed, like over-the-counter medications that can be abused, overused in all patient demographics. And we're going to talk about novel substances like kratom, kava, and Ben's favorite, inhalants. If we have time, or we'll split it up into 2 episodes. So we'll just kind of see how it goes.
I think this is a good one because at Rock, our demographic is all ages, to be straightforward.
Yeah.
But a lot of parents feel like their kids will do well with us. In particular, just to be straightforward, younger men, because we do the workout, the adventure stuff. But with that being said, I'm glad we're covering this topic because we do see a lot of addiction, patterns, if you will, take off through these over-the-counter stuff, the cough syrups, etc. So they're readily available. You don't need an ID to get quite a few of them, and it's a launching off place. And in my opinion, my experience, a lot of them don't seem very enjoyable, but people do get hooked on them big time. And we see, just like any other drug of choice, I've had clients come through Rock that I've worked with. They will tell you their drug of choice is cough syrup, and the amount of cough syrup they drink in a day is, it's so gross anyway. I just don't even know how you stomach it. But
Yeah.
I had a young lady that was drinking up to 8 bottles of Robitussin a day. That is insane.
Especially because of all the other ingredients that are in it. It's not just that one ingredient that they're looking for, yes, but there's multiple other ingredients that, like Tylenol, for instance, can cause a lot of other issues that they're not aware of.
What is it about Tylenol? Doesn't it affect your liver?
It can, yeah. It can cause it can cause liver failure, like liver toxicity.
The acetaminophen? Acetaminophen? I like that word. Kava and kratom are, I personally think, and trust me, we're going to get comments on this because there's always 2 camps. There's the pro-kava and pro-kratom, and then there's the anti-kava and kratom. I personally fall 75% anti, 25% pro. And Ben, are you surprised to hear that, Ben?
I think so.
Are you, T? Mm-hmm. Okay, so let me explain why.
What percent pro?
25.
Okay.
75% anti.
Okay.
Or 90-10. I don't know. The point is, for me, I do think that there could be a time and a place for kratom use, but not for drug addicts.
I don't disagree with that because I think it comes down to, let's look at alcohol for 1 second. I know people, I got no problem if you drink. If you're a normal person that's capable of having 2 drinks and then you call it and that is your pattern for the rest of your life, like it's not causing problems, fine. You give it to me, it doesn't stop there. You know, you give me kratom, it's going to lead me back to heroin because it gets those opioid receptors going.
There
The
we
mu,
go.
yeah.
The mu.
Yeah. That was good, Ben. You paid attention in class.
I did pay attention in class.
The only example that I know of that, and this person is very open about his kratom use, is Chris Bell. And Chris Bell is Mark Bell's brother, and Mark and Chris's brother died from an opiate overdose. This goes back probably 15 years. And Chris Bell was also addicted to opiates, but he also had a double hip replacement and a lot of chronic pain, and I think is how he ended up getting addicted to opiates. But he's very open about how kratom helped him get off of opiates. Now, that's the one singular time that I've not seen with my own eyes, but at least have heard. And he actually has a documentary, a Netflix documentary called A Leaf of Faith. And it's very pro kratom. So take it for what it's worth. I mean, there's obviously always going to be instances out there where somebody can prove you wrong. It's like the whole relationships in early recovery thing. Out of 1,000, a couple are going to probably work out, but then the other 998 are going to think, well, I could be one of those too.
Well, just as a quick example, and I want to keep this part brief, but like marijuana versus being on an opioid pain medication such as Oxycontin. Like if marijuana helps somebody's pain, my opinion is I'd rather have them do that than Oxycontins. But like I think for the sake of this episode, you know, just kind of making it clear, because I can make arguments pros and cons regardless of which side I fall on with my personal opinion. But like I think for the context of this episode, like focusing on, I mean, let's call it what it is. We're going to be focused on the negatives of it because what all the substances that Dr. T mentioned that we're going to be talking about, I've seen the bad side of it. So the potential is there, you know, and I think maybe we should focus on that.
Yeah, of course. I agree. All right.
It's more, I think too, it's more about just education and awareness, you know? I mean, a lot of the over-the-counter stuff, usually you see in younger, like adolescents, late adolescents. And then there's a lot of data that shows that later on in life, it can lead to more substance use disorders that are heavier and bigger of a problem. So it's more just about education, awareness, and trying to just open people's eyes to what else is out there.
I think that too, it's a bridge in the fact that a lot of these substances mentioned very closely mimic other quote unquote harder drugs, like kratom mimics heroin or fentanyl, if you will. And if a young kid's doing kratom, they're like, and their buddy's like, ooh, fentanyl is better. Try this. Or like what's in a cough syrup, for instance, dextromorphan. I've heard people compare it to PCP. So they're like, you know, I've seen that addiction right there where people start off with cough syrup. Actually, that young lady I was speaking of earlier with the 8 bottles of Robitussin, her drug of choice ended up being PCP, but Robitussin was just easier for her to get.
Right.
But it started with the Robitussin. But maybe we should like pick one substance and like kind of go from there. Yeah.
Well, let's start talking about the dextromethorphan.
Okay.
Is that how it's pronounced? Dextromethorphan?
N-A-N.
Meforthan. Dextromethorphan.
Or
well,
DXM.
then I've been saying
I call it dextromorphin.
so did I, but DXM is the way to go. Ain't there a rapper DXM?
That's DMX.
DMX.
Oh, DMX.
Dad.
But I don't know, also known as, like, what else have you guys heard it?
Is that
Sling.
Scissorp?
No, Scissorp's different. This is like robo tripping, Skittles.
I've never heard Skittles.
What else I had? Triple C's.
Triple
Oh, Chloroseed and cough and colds. Yeah, my buddy used to eat those like Tic Tacs. He would eat them by the box, and it would trip me out so bad. Like he would stare at a glass of water for hours.
Really?
Yeah, and like just I don't even know. Be out of his mind.
They're called triple C's: cold, cough, and congestion. It's a little orange box.
It's
Yeah,
Coricidin.
Chlorocidin, cough and cold medicine.
Yep.
You can't get them. I mean, they're locked up now because people were, stealing them and blah 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 blah. Anyways,
But DXM, that's where we're at.
Yeah. So to touch on how you said it mimics other substances of abuse. In particular, it's classified as a dissociative. So it affects certain receptors in the brain that increase the neurotransmitter mainly involved. It's called acetylcholine. What falls under this class also that we can talk about on a later podcast is ketamine. So they're under the class dissociatives. So I don't know, Ben, why don't you give us a story to start? And
On DXM,
on
so
DXM.
of course we got a group text going last night, the night before.
Yeah.
And Dr. T's like, so Ben, have you done DXM? I'm like, why aren't you asking Tom? What am I, the junkie in the group? Tom's your regular old norm alcoholic, little cocaine, little Xannies.
yeah.
But yeah, I've done a lot under the sun. Maybe not everything now. They're coming out with new stuff. But DXM is something that I experimented for a little bit with in my rave days. And we were actually getting off the street in pill form. They were actually making it straight DXM. And the dissociative part, for me, this stuff wasn't fun. But being an active addiction, somebody puts something in front of you, you do it. You don't think about it. I don't know why. You're like hoping that it'll be better the next time. But I think for myself to kind of explain it, it's one thing it really threw off for me was like my depth perception. I was actually at Ultra Music Festival one time, had to leave early because I took too much of it, was vomiting everywhere, but I had a really hard time getting back to the hotel because like I'd go to step off a sidewalk and it would be like, it felt like it was 2 stories high and I couldn't figure out what depth to put my foot. And, Ultra's going on, so they got police cars with their lights on, and I felt so out of body, like your mind dissociates from your body. It's like almost a separation, and personally, I didn't really like that too much.
That's kind of how I am when the therapists start talking therapy stuff. Anyways, leave it to me to throw in the little jokes.
Yeah,
but go ahead. Sorry.
Tell us your story about the...
Oh, so another thing that the kids do is like they'll get the Robitussin, for instance, they'll tie it to a shoelace and helicopter it, which is a centrifuge. Is that the right?
They centrifuge it.
Yeah. So, and it separates the ingredients, I guess, what would you call it? The active ingredient from the filler, maybe the flavoring, but you can see it separate into 2 parts, and they'll drink just the part that's the psychoactive part.
Right.
But yeah, so there are different methods of abuse, and that just to throw it out there for people that think that maybe this isn't very common, like there has been episodes on intervention with people, their drug of choice is DXM, and because it's so accessible, so.
And we've had some clients here as well. I think it flies under the radar, but I mean, it's labeled as a non-addictive cough suppressant. That's how it's labeled and marketed. And then it's in all like your Robitussin, your cough syrups, they're all out there.
What is it though about that that suppresses your cough? Like, do you know that answer? Like the medical?
I do. So a lot of the things that we're going to talk about, they act on there's multiple receptors that it affects in the brain. Like I said, for this one in particular, this one increases acetylcholine, but going back to our different types of opiate receptors, specifically, this acts on your opiate receptors to help suppress the cough. So it acts on not the mu opiate receptor, a different subtype of the opiate receptor, which specifically causes your cough to calm down. Similar to like codeine. Like codeine's also labeled as a cough suppressant.
It is?
As well.
Oh.
Yeah. You can get like Robitussin with codeine in it. So that's why it does that, but it does act on like serotonin, and so like there's interactions, like if you're taking an SSRI, You can get something called a life-threatening syndrome, serotonin syndrome, with it. So if you're using it with other medications, that's why it can also be an issue.
Interesting.
There's definitely something to that, because I'll tell you, when I get a cough or some, and I've, over the past couple of years, I've had 2 or 3 pretty intense cough, having 3 kids, God only knows, what they're bringing home. But I've tried I guess you would call it holistic route, the teas and the herbs and the, even like Vicks Vapor Rub and all those sorts of things. And it never does anything. But as soon as I take like Robitussin or any sort of cough syrup or whatever, it works. I mean, I don't know why or what or how, but it's the only way that I'll be able to get any sleep. But man, I'll tell you, if I take that stuff at night, because if I, obviously want to get sleep, like NyQuil, my dreams are ridiculous and extremely vivid, but like not pleasant,
Yeah.
I don't know what it is or why it does that, but
I think part of the reason I didn't like it as a drug of choice personally is I don't associate any euphoria with it. I like drugs that you get euphoria. I feel like something about DXM, it's just dissociative with no euphoria. I don't know if there's a scientific thing to that.
Just going not too scientific, but they describe stages or plateaus associated with it, and it's the different milligrams that you're taking. So when you're just downing 3, 4, 5 bottles, I guess you could calculate, there is, 5 milligrams per X ml in each teaspoon. There's how many teaspoons per bottle if you wanted to get nitty gritty. But the 4 like plateaus that they call it, it says like plateau 1, it's usually between 100 and 200 milligrams, and you just get like a stimulant kind of effect. And then the second plateau is when you start getting like euphoria, hallucinations, maybe. And that's between 200 and 400 milligrams. And then the next step up, your third plateau, is when you get the disassociation, like an out-of-body experience. And that's at doses between 300 and 600 milligrams. So very, very high dosing.
So it sounds like I skipped phase 1 and 2.
And you just went directly to stage 3 and 4. Like stage 4 is like complete disassociation. But the scary thing is it can cause coma, unresponsiveness, like respiratory depression. It can be a medical emergency. So you were probably like in that stage 3, stage 4, like.
Well, I thought
right
I was going to
away.
die. I left the rave. Like, things were not good.
Right. But that too, like, I guess people are different, but disassociatives, like you have to be willing to lose control. And if you don't like that kind of high per se, then the dissociatives like are not for you.
Yeah.
well, they're not for anybody.
Well, I'm not trying to
ever. But if you're going to do it, make sure you like to lose control of all inhibitions.
Right.
Or stick to phase 1 and 2.
Or stick to phase 1 and 2. Yeah.
Right. So that's why it's like it just goes from, 0 to craziness.
I mean, it's very dangerous stuff. In the end, it's like, and that's not even taken into consideration, which we can touch on briefly in terms of the organ damage that those things do. Mm-hmm. After years worth, and I'm sure people have done it for, years, maybe a couple, 2, 3, I don't know. But like, what would it do? I imagine, me not being a doctor, but I would think that it's not good for your liver, your kidneys, really anything.
The long term, we don't really necessarily know the long term, like central nervous system effects, but over a longer period of time, there's going to be damage done.
And maybe it's from all the other ingredients that's in it too, because doesn't your liver process all that stuff?
Well, Tylenol or like we spoke earlier is a big
acetaminophen.
Yes, is usually a main ingredient combined with these cough syrups. So that's a big, factor in it as well.
Yeah.
Can I just make a quick disclaimer?
Ben's nervous.
Yeah, can you tell? I make light of a lot of this stuff like my experiences and whatnot. And I can laugh about it now, but just to be straightforward, like I know it's also not funny. Like being someone in recovery, I can look back and be like, that was tragic and like chuckle.
Right.
But that comes with years and years of recovery. But like if I sit here and think about those experiences, like they do give me anxiety to think back, like, oh my God, that situation, that was like,
Scary.
it is scary. So I don't want it to seem like, I'm out here
we're not glorifying.
it or
not
but
in any way. Just to put that knowledge out there, because
Yeah.
people don't know, and they'll just drink 4, 5, 6 bottles till they get their desired effect. But at that point, it may be too late,
Yeah.
because it says the onset is within 30 to 60 minutes. So it's not like you're sitting there with your watch waiting and then.
Yeah, you wait for 10 minutes, drink another one, 10 more minutes. Yeah.
So
I mean, it's nasty stuff.
Yeah.
It doesn't taste, it's nasty to the taste too. Ugh, gross.
before we get to that, going back, another commonly over-the-counter abuse medication is Benadryl.
Oh.
And so I know maybe a lot of people don't associate those two things together, but Benadryl taking high doses as well causes the same effects as the DXM. So Benadryl abuse is a real thing. I've seen it here. I've seen it
here too.
multiple other places. So same effects as DXM, but it's just something to keep on.
I thought Benadryl was
radar.
just a brand name.
Diphenhydramine, I guess, is the generic.
Also
So,
known as Visceral, right?
Well,
Are they the same?
Visceral is a sister of Benadryl. But
Okay.
Benadryl itself, like just sticking with that, it's an antihistamine, so marketed, for allergic reactions, allergies, etc. But it does have effect on those other receptors, like that increase acetylcholine, like the DXM. So people don't necessarily know that or like the biochemistry of it, but that's also.
So what's Claritin?
Claritin is also an antihistamine, but it's a second generation non-sedating, not to get into too much pharmacology.
Benadryl is interesting. 'Cause, like, if you think of the insanity behind it, in my opinion, if we have somebody sitting here, like, because we'll have parents bring a kid in and they're like, oh, all they did was some Benadryl. But when you ask them the quantity that they took, usually they're like, I took 60 pills. Like, if you've taken 60 pills of something is off. Like, there is definitely underlying issues. You are definitely trying to escape whatever, achieve some. Yeah. And a lot of times what ends up happening in the cases I've been familiar with, it's generally younger people that, again, they had access to alcohol somehow, but then mom and dad found out, took it away. So they're like, ooh, I can get this Benadryl. A lot of the cases ended up that way. Something being removed that they initially had access to, and then they go to that. And if you're taking any pill in that quantity, like, in my opinion, you qualify for some sort of treatment or at least therapy. Let's take a real good look at this.
Yeah, I mean, all of the guidelines tell us as practitioners, especially in the like late adolescence, early adulthood, like if you encounter someone who is taking these types of substances more than they should, then you really need to start screening them for co-occurring like anxiety, depression, co-occurring mental health, and then co-occurring substance uses disorders, and really start doing like your screening, your early interventions, the referral to treatment, things like that. So,
And then the next one that you were going to talk about was the
Pseudoephedrine.
yeah, there you go. And phenylephrine.
And phenylephrine, not to be mistaken for
ephedrine.
Yes, that was it.
That
That wasn't it. But I was trying to think of the. Never mind. Go ahead.
Go ahead, rescue me.
Okay. So these are marketed as decongestants over the counter, so they're readily available. Obviously, I feel like there's more red tape, I guess, on the pseudoephedrine, just because people.
Is that going to be like your hydroxy cuts? Or no, that's ephedrine.
Back in the day,
But it
Yes.
doesn't contain it anymore. These are going to be like your Sudafed.
Oh,
Your nasal decongestants
God.
when you're
Yeah,
sick.
Yeah,
maybe we need to like get into the history a little bit. So I don't know where ephedrine initially came from, but it was marketed as a diet pill. Is that probably accurate? That's about all I know.
I'm not 100% accurate on that, but it was.
Ephedrine was originally the original fat loss miracle drug that came out, in probably the early 90s, if you will. I remember seeing all the Muscle Mags and Flex and all that. And they were putting them in like pre-workout stuff along those lines. I guess a few people had heart attacks because it works very effectively. Too effectively, clearly. But they ended up banning it. Is it completely banned?
From what I understand, yeah. The FDA pulled it.
And then I guess people started recognizing that in cough syrups is pseudoephedrine, which is ephedrine minus the pseudo. I don't know what the pseudo stands for.
It's just structurally they changed changed around the biochemistry a little bit of it.
So it's like one molecule different kind of thing.
It's like meth and Adderall.
So it goes back to like you take one thing away, the government makes one thing illegal, and then they just get the next closest thing, which essentially if it's one molecule off, it's not that much different. But I guess people figured out they could abuse pseudoephedrine once they couldn't get ephedrine. So
yeah, and I think a lot of, I mean, you guys can correct me, but before getting into this realm, you just see on TV or like even if you go to buy it at the store, whatever pharmacy, you have to show ID. But they also limit the quantity you buy because people were buying such high quantities and they were using it to make meth.
Oh, yeah. Breaking Bad.
you remember what they call the people that they send into the pharmacy to buy them?
No.
Smurfs.
Smurfs?
Yeah, so like you would gather all your local meth heads in the town, the dealer would. And basically like if you're limited to 2 bottles, then you get all your Smurfs and you send them in for their 2-bottle limit.
Oh, okay.
And then your Smurfs come back and the meth guy makes it. But now they got super meth labs in Mexico.
Yeah.
So bypassing all that stuff.
Yeah. I mean, the reason they're so heavily sought after is because it's structurally very similar to amphetamines and methamphetamines. So if you take enough of it or use it to combine it with other things, then you're going to get that high as you would using stimulants or meth or methamphetamines.
Have you seen a lot of cases for pseudoephedrine?
I have not. No, I mean, probably because they've cut down on it now, and I feel like meth's pretty cheap to buy.
Yeah, people just use meth.
Yeah.
So, yeah, I mean, if you really think yes, you do. It's like, it's like when people couldn't afford oxys anymore and they started just using straight heroin.
Well, I feel like that could go back to going again what we were talking about younger folks. They might not even have an ID to be old enough to buy that stuff, but heck, how many bottles of cough syrup that are half gone are in my medicine cabinet at home? Right. For me, for the kids, for whoever. And you got a kid that doesn't have something on that they drink that, they're like, ooh, and pseudoephedrine, and then next thing you know, oh, meth, it's the same thing, so.
Yeah.
Does it expire, cough medicine? I mean, there's an expiration date on it because I found one that was expired in 2021, but it's all I had. So I ended up using it, and I'm still here, but.
I mean, with it expiring just means the active ingredients become less effective. So
kind of like
pharmacies have to put expiration dates on everything that's manufactured.
It's a lot. Like I look at my pink Himalayan salt and it says sourced from a 3 billion year old salt bed, but then like it just so happens to expire on the date that I have it. What are the chances 3 billion years later?
Yeah, that's funny. What is or do you have more on the pseudoephedrine?
No.
I mean, that's something that is again, a lot of these substances, although they're available within drugstores and stuff like that, it is relatively difficult to get them. You do have to show an ID a lot of times. At least a lot of the drugstores around here, they have them behind a glass wall or something. But Ben, I like the point that you brought up is like, I have young kids at home, and if they ever took anything, it would be simply by accident. But as our kids get older and you never know who they run into, what they hear. You know, my buddy that was doing triple C's, we were 15, 16 years old. And I don't know where he heard about it. I have no idea, but he was doing them. So it's one of those things that chances are you have this stuff within your house, and be mindful of the fact that, you know, have it put away somewhere, because kids can and will get into it. I mean, my daughter, Winnie, she's 4. About 6 months ago, she ended up taking one of my wife's
I remember that.
heart medications.
I remember that. You called me when that happened.
Yeah, and I don't know. I mean, she's extremely mischievous and like gets into everything, but it happens that fast, you know. So,
And Winnie was okay, just for anyone
oh yeah,
wondering.
she was totally cool. We took her to the emergency room, and you know, everything was fine. Did I ever tell you about the story when Levi got into? We are good parents, I promise. It was Levi's 4th birthday, and literally on his birthday, woke up at like 5 o'clock in the morning for whatever reason. And I just went to go check on, because at the time Hattie was probably 2, and I was just and I could see the bathroom door was closed and the light was on, you know, and like, so I'm like, well, that's odd. And so I go to open the door and it's locked, and I'm pounding on the door, and I'm like, what the heck? And I walk in there, and Levi just starts screaming. He climbed up on the sink, got into the medicine cabinet, and got out a whole tub of Icy Hot.
Oh, no.
And thought it was like lotion, and just started putting it all over him, and like in his butt, and you know, in like his butt crack and everything. I felt so bad. And his birthday party was literally at 9 o'clock that morning.
Oh, poor
Yeah.
Levi.
But we also had a tiny kids bottle of Motrin, and the cap was off and the bottle was on the floor. So we had to assume that he drank it. So we took him to the emergency room, and for whatever reason, they said that if it was Tylenol, it'd be a different story. But since it was Motrin, not a huge deal. But I tell you, I'd like to say ever since then, things have changed, but Winnie got part of my life, you know, I mean, it's just something you got to be careful with this stuff. It really, I don't know. It causes a lot of anxiety for me, you know, and it should you too. So, well, that was fun.
That was fun.
Did we accomplish everything we wanted to accomplish, Ben?
I think so. In my opinion, it kind of turned into like keeping an eye out for your adolescence. You know, this is where this starts. And I remember for myself, like being in high school, thinking back, I would have taken anything to get outside of myself. Like, and I've shared on the podcast before, if there's any new listeners, like by the time I was a junior in high school, I had a severe drug problem. And at that point, I would have taken anything, you know?
Yeah.
Well, and if you are a listener and you've been listening for a while, and you have people in your life that are young parents that have young children, you may think to yourself that, a lot of this stuff doesn't pertain to them, but when in fact it can and will, maybe. So share it with them in some capacity, because we are going to, and the three of us, we've talked about this, making more of an effort to reach families that have adolescents as children, because they're just as lost as, you know, other parents that have adult children. But the unfortunate thing for the parents that have adolescent kids, they're still your children and they're under 18. So it's not like you could just throw them out the house.
And we had Chris Martinez on here.
Yeah.
He runs the facility.
Resilience.
Yeah.
Yes.
And they're an adolescent program. But I bring this up to anybody that might be sitting there thinking like, oh, there's not that many young kids with drug addiction problems. At my home group on Friday nights, they bring vans in there, and you got these kids that are 15, 16 sitting in meetings, and I've interacted with these kids, and I will tell you that they are drug addicts and alcoholics at that age, going to these meetings, and they are qualified to be there, in my professional opinion. And I'm not even the one working with them. I'm just interacting. I try to be nice, like, hey, man, what's going on? Little, 16-year-old kid at this meeting that's full of adults, and unfortunately, but maybe fortunately, they're in the right place.
Yeah.
I don't know how to phrase that one, but
But it's true.
it's true. Yeah.
Yeah.
So
I was looking for Chris Martinez's episode and I can't find it, but it's in there somewhere.
that was a phenomenal episode. If
It was him and Matt Anderson.
if you have a someone under 18 going through this, that's a wonderful episode to listen to, because they give some great insight about how to approach them, and not necessarily saying, why do you do this, but asking them, like, what is it you like about it? Approaching it in a very
I'll
soft,
find it
kind
and put
way.
it in the show notes,
Yeah, for sure.
which I'm terrible at doing. I don't ever put anything in show notes, which we need help with that. We're going to get there though, T.
We are.
All right. So is that it?
I think
That's it.
so.
All right. That is it for this episode of Real Recovery Talk. Thank you for tuning in on the podcast app. In the end, if you have any comments, questions, or concerns, you could always reach us, info@realrecoverytalk.com. Again, it's info@realrecoverytalk.com. And ultimately, we want to help you turn your mess into your message. That is it. We will see y'all later. You guys didn't say here. Bye.
Bye.
Oh, bye. I was thinking.